Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe for updates. Granulomatosis with the polyangiitis. So this is previously known as the Wegener granulomatosis. So it is aka the Wegener granulomatosis, and it is a necrotizing vasculitis. Of the small arteries and the veins. So this is of the small arteries as well as the veins, along with the granuloma formation. So there is also the presence of the granuloma formation which is occurring. Next is it presents with the triad of the upper and the lower respiratory tract. So there is involvement of the triad, and this is of the upper as well as the lower. So there is upper and the lower respiratory tract involvement, and there is also the glomerulonephritis which is involved. Next is the important organs which are involved. So what are the important organs? Important organs, there is upper respiratory tract, and this presents with the paranasal pain, so paranasal sinus pain, as well as this SOM, that is the serous otitis media, then the nasal septal perforation. Next we move on to the lower respiratory tract. So under lower respiratory tract, there is presence of cough. So there is cough, there is hemoptysis, as well as there is multiple bilateral cavity nodular infiltrates. So multiple bilateral cavity nodular infiltrates. So moving on to the renal, what is present? In renal, the patient is present with the rapidly progressive renal failure. So rapidly progressive renal failure, and there is also the crescentic glomerulonephritis. Now let's look at the eye. So in terms of the eye, it presents with the conjunctivitis. Next, there is presence of the scleritis, there is episcleritis, as well as the dacrocystitis. So this conjunctivitis, there is scleritis, episcleritis, as well as a dacrocystitis. Now let's move on to the skin. So in terms of the skin, what do we see? So in the skin, there is papules, there is vesicles, there is palpable purpura, and the subcutaneous nodules. They are present. Now let's look at the histopath. So under the histopath, it shows the necrotizing vasculitis. So there's necrotizing vasculitis, and this is of the small arteries and the vein. And this is basically of the small arteries plus the vein. And this is along with the granuloma formation. So this is along the granuloma formation. Now, the important lab findings are of the granulomatosis with polyangiitis. The important lab findings, if you see, they are nothing but the elevation of the ESR. So the ESR is increased, there is a positive CA and CA. There is a positive CA and CA antibodies, and there is mild elevation of the rheumatic factor. So there is elevation of the rheumatic factor as well. So how do you treat this granulomatosis with polyangiitis? So there are two phases. One is the induction phase. So in terms of the induction phase, there is cyclophosphamide, CP cyclophosphamide. It is combined with the steroids. Next is the remission phase. So in terms of the remission phase, you give the methotrexate plus the azathioprine. So it's methotrexate as well as the azathioprine. To learn and grow daily like this, please do subscribe.